and I know it's gonna be a lovely day.
Public Health, Climate Change, and Health Equity section. Before we start, we will have English and Spanish speaking presenters today. So I want to provide some instructions for turning on simultaneous interpretation for all attendees. To turn on simultaneous interpretation, please find the globe icon at the bottom of the Zoom screen and select your preferred language, showed by the yellow arrow. The mute original audio options will turn off the overlay of voices for a clearer sound, showed by the red arrow below. This applies to those listening in English as well. So if you hear more than one voice, please click the globe icon and then click English and then mute the original audio. Please note, if you don't see the globe icon on the bottom, your Zoom software may need updating in order to take advantage of these interpretation functions. Now I will give the translation instructions in Spanish. Bienvenidos, buenas tardes. Gracias por acompañarnos a la reunión de hoy del Grupo de Trabajo de Salud Pública de Acción Climática de California. Mi nombre es Abigail Ramírez y trabajo en la sección de Equidad en Salud y Cambio Climático del Departamento de Salud Pública de California. Antes de comenzar, el día de hoy tendremos presentadores que estarán hablando en inglés y en español. Por lo tanto, quiero compartir instrucciones para activar la interpretación simultánea para todos los asistentes. Para activar la interpretación simultánea, busque el símbolo del globo o el mundo en la parte de abajo de la pantalla Zoom y seleccione su idioma preferido, como muestra la flecha amarilla. La opción silenciar audio original desactivará la superposición de voces anteriores. Si escucha más de una voz, seleccione el símbolo de globo, luego haga clic en inglés y luego silenciar el audio original. Tenga en cuenta, si no ve el símbolo de globo en la parte de abajo, es posible que su sistema de Zoom necesita ser actualizado para así poder aprovechar las funciones de interpretación. Ahora le paso la palabra a mi colega Trinity Smith. Siguiente pantalla, por favor. Next slide, please.
Thanks, Abby, for those instructions, and welcome again, everyone. My name is Trinity Smith. I use she, her pronouns, and I am speaking to you from unceded Nisenan land. I serve as the Health Program and Policy Specialist with the California Department of Public Health, Climate Change, and Health Equity section. I'm joined today by Dan Wu, Team Lead, and Linda Helland, Manager of the Climate Change and Health Equity section, who will guide us today throughout the session. Today's meeting is being facilitated by our team at the California Department of Public Health, CDPH, and the Climate Action Team Public Health Work Group is usually co-led by CDPH and the California Air Resources Board. Our work group meetings are designed to provide a forum for public health partners and other stakeholders to learn about and discuss timely issues at the intersection
para poder aprender acerca de las intersecciones entre lo que es la equidad de salud y el cambio climático. Y el día de hoy se va a centrar en lo que es la preocupación de las poblaciones, los impactos que ha tenido el cambio climático y lo que se puede hacer para poder cuidar a la salud de los trabajadores, en particular los trabajadores esenciales.
To a just and carbon neutral economy. We also plan to discuss lessons learned from the COVID-19 pandemic, response and recovery for essential workers.
Hablar acerca de las recuperaciones de los trabajadores esenciales para poder promover la salud de los trabajadores durante el impacto del cambio climático. Así que también tenemos otras cosas que tenemos que mencionar acerca de esta reunión.
Interpretation Real-time captions are being provided today by eCaptions. You can find the closed caption feature along the bottom of your screen as seen on the slide here. We'd like to remind presenters to speak clearly and at a measured pace for our captioner and interpreters. For this meeting, we have muted all attendees, but we encourage you to submit any questions or comments through the chat feature, which is found along the bottom of your screen in the Zoom controls bar as well. We also ask that if you are not presenting to please turn off your video. And we believe for optimum viewing, that if you go into the right upper corner of your screen and click on the view icon, you can select standard or side-by-side speaker view, and that will give you the best options. And if you are having any technical difficulties, please send a private chat to myself, Trinity Smith, Dan Wu, or our colleague, Britt Higgins. And a reminder that this meeting is being recorded and should be posted online about a week after today at the link on the screen here. And we'll post this link in the chat as well. And with that, I will turn it over to Linda to provide some introductory comments.
Thank you so much, Trinity. I want to thank our team that organized today's event, including Abigail Ramirez, Britt Higgins, Dan Wu, and especially Trinity Smith, who took care of every detail, always keeping equity front and center. The COVID-19 pandemic has laid bare how structural inequities, including economic inequality, racism, and the profit imperative have contributed to 1 million COVID deaths in the US and counting. And similar perverse economic incentives have prevented adequate action on climate change, with US greenhouse gas emissions rising 6.2% last year compared with 2020, despite more than 40 years of scientific alarm bells urging emissions reductions. The renaissance of the term essential workers revealed who was least protected, with people who work in warehouses, in agricultural fields, in food production, in service and caregiving industries, facing risk of illness to hold up our economy. These essential workers.
Así que son los trabajadores esenciales, son los que mantienen productividad en California y también las temperaturas que rompen récords y también los incendios forestales, pero también están marcando rangos históricos en lo que es en el año 2021. Entonces, proporcionado para que los trabajadores pueden quedarse en la casa y mientras que sigan recibiendo sus beneficios. Similarmente, hay más de suficiente en la sociedad para proporcionar condiciones seguras para los trabajadores esenciales y cuidar de las necesidades de los trabajadores de campo para que lleguen a ser una economía neutral de carbono. Y varios han tenido que escoger entre sus cheques de pagos y su salud, porque ya sea si quedarse en una fábrica o cuando está viniendo una ola de calor o algún problema, o es no recibir ese sueldo. Entonces, ahora los sindicatos selectivos van a proporcionar mejores beneficios y de ya sea proporcionar un control.
And address other work conditions that are associated with coronary heart disease, high blood pressure, musculoskeletal disorders, and stress. Unions raised overall compensation, including wages and benefits, by about 28%. And when people have living wages and good benefits, their health improves. Additionally, by creating a higher prevailing wage, unions raise the income for non-union workers as well, thus reducing inequality. However, many of the jobs in the clean energy economy or held by essential workers are not unionized and do not provide as good pay or benefits as fossil fuel jobs. These are some of the many challenges faced by workers, unions, community-based advocacy organizations, and government agencies that have continued to support workers at greatest risk throughout the pandemic, and to continue to seek greater worker rights and protections. Today, we'll hear about worker protection efforts from various sectors and perspectives. The Secretary of the California Labor and Workforce Development Agency, Natalie Palugiai, will share how her agency hopes to address these issues at the state level. And Amy Heinzerling of CDPH's Occupational Health Branch will address which worker groups are at the highest risk of heat illness in California. Then we will hear from Eulalia Mendoza and Josefino Cervantes with the Mixteco Indígena Community Organizing Project, or MICOP, along with Claudia Quesada and Yasmin Alvarado from Líderes Campesinas, about their firsthand experiences throughout the historic summers of 2020 and 2021, as well as Isadora Nogueira with the Achieving Resilient Communities, ARC project of the Public Health Institute, and Tim Shaddix from the Warehouse Worker Resource Center about their respective efforts to educate and organize around worker protections and rights. David Hornung of the California Division of Occupational Safety and Health will share lessons learned through the COVID-19 pandemic around enforcement and worker engagement. Chris Eclarino and Natalie Delgado of Climate Resolve will share recommendations for specific actions different sectors and actors can take to safeguard worker health in a changing climate. Edward Orozco Flores will share the exemplary community-engaged research approach of the UC Merced Farm Worker Health Study. And finally, Sloan Viola of the Office of Planning and Research will share highlights of how the state climate adaptation strategy is safeguarding worker health in a changing climate. Although our discussions today will largely center on farm workers and warehouse workers, many of the issues and strategies discussed could apply to other essential workers facing climate risks. These include emergency responders, caregiving and domestic workers, firefighters, utility workers, food production workers, manufacturing workers, and transportation workers. We hope to shine a light on root cause solutions for incorporating worker health protections and rights within community resilience efforts in California's transition to a just carbon neutral economy. Now I'm eager to pass it over to Dan Wu, my colleague, who will introduce our first speaker. Next slide. Thank you.
Thank you, Linda. So we're so grateful for our opening speaker, Secretary Natalie Palugiai, for taking time today to provide some opening and framing comments. Natalie was appointed Secretary of the California Labor and Workforce Development Agency by Governor Newsom on July 2021. The Secretary is the first Latina to serve as the California Labor Secretary. In her role, the Secretary serves as the Governor's Cabinet Advisor on labor issues and employment programs for workers and businesses throughout California. She oversees the state departments and boards that enforce labor laws, including minimum wage and occupational safety standards, provide state disability and unemployment insurance benefits, fund workforce training and apprenticeship programs, protect injured workers, and many other activities. So we're delighted to have you join today, and over to you, Secretary.
Thank you, Dan. And I want to thank my colleagues at Public Health for having me here today for some opening sort of framing remarks. I also see our on the call here, I see a few names that I recognize, and I want to give a shout out to our partner research institution over at the UC Merced Labor Center. I feel like this is a very timely and appropriate conversation that links the outcomes of health with the outcomes of increased voice in the workplace. And so I look forward to these next few minutes. I was asked to answer two key questions. The first one was around how labor agency is addressing the root causes of inequitable working and living conditions. So this is not an easy question. And I think it really depends on how we define root causes. So that's the key. If we understand causes, we can think about solutions. And at Labor Agency, there are many areas that we focus on and many sectors that we focus on, but ultimately the key drivers of inequity that we think about every day are going to be the lack of inclusivity in decision-making. And so when we think about those who have been excluded for generations from accessing opportunity, education, wealth, prosperity, and continue to have no voice.
Y de prosperidad. Entonces, esto nos da la voz para poder ver las necesidades de las comunicaciones que no se está escuchando y poder ser parte de una comunidad o una región económica o un plan de desarrollo para que podamos continuar la perpetuidad de esto. Varios han servido una comunidad acerca de los fondos de resiliencia, lo cual es una subvención que va a
And what it focuses on is inclusion as a key way of planning and thinking about economic development. Well, at Labor, when we think about workforce and the workplace, we call this inclusion and balancing of power, worker voice. And so the lack of worker voice in a power structure
y
at the work.
también cuando estamos hablando en la estructura de un lugar de trabajo, cuando estamos diciendo que está muy inclinado a hacerle el empleador, entonces por eso es que estamos hablando mucho de esto y es mucho de las cosas que hemos diseñado en nuestros programas y en nuestras pólizas, es para balancear esto. Entonces, ¿qué es lo que estamos haciendo en práctica? Y quiero cubrir dos áreas específicas. En la parte de ejecutar, entonces, la agencia laboral tenemos 3 baldes muy grandes de trabajo. Entonces, uno ejecuta a la salud de los trabajadores, la otra es acerca de los pagos y luego hay otro balde completamente dedicado a lo que es la administración para los trabajadores, que incluyen cosas como la discapacidad, el seguro de desempleo y ese tipo de cosas. Y tienen una agrupación de divisiones y programas para pensar acerca del desarrollo. Así que primero quiero comenzar con la ejecución. En el espacio de ejecución no es solamente para
regulations and having enough people to go out and actually inspect workplaces for safety and health, wages and hours. Because we know that we simply will never have enough resources to reach every workplace. And so what is very important in the enforcement space is how strategic we are in that enforcement. So we look at what are the most challenging sectors and industries where we see high rates of violations. And within those industries, where are the worst actors? And so that takes quite a bit of analytics and data, but it also requires a lot of intel from workers. So being able to listen to workers, receive their complaints also helps us target workplaces. Well, when workers don't have voice in the workplace, that intel is really limited. And when we think about our workforce, only 10% is unionized approximately in California. So it's a real struggle to ensure that industries are providing this voice for workers. In order to address this, one of our strategies has been to grow our partnerships with community organizations that look like and speak like and live like the workers that we are trying to protect. And while this sounds very common sense to many of us here in this Zoom space right now, that hasn't always been the case. Government has always tried to do this work on its own. COVID was a real opportunity for us to understand the power of partnering with community-based organizations and other groups in communities so that workers can learn about their rights and so that those groups can also serve as a voice for workers when they have none. So worker voice, when we're able to increase it, it disrupts inequity in the workplace specifically, it also helps us as an agency be more strategic and effective in our work. So that's sort of where our priorities are moving in the enforcement space connected to worker voice and breaking down inequity. Now, the other important part of our agency is workforce development and training. And we are trying to apply some of those same principles of voice to the investments that we are making across the state in training programs. Gone are the days of training someone and then saying, good luck, we wish you well and hope you find the job. The state has really been shifting in the last few years and is continuing to make very large shifts toward what we call high road training partnership investments. And they are called high road partnerships because they bring employers, workers, unions where they are available, and if not, other worker advocacy groups, higher education, other training partners, all around the table to be able to design career pathways, training, support services, and placement services that both meet the needs of industry while raising the voice of workers in these sectors. They're also considered high road because they focus on more than just training. So focusing on core supports for those that we are trying to serve so that they can complete training, so that they can be successful in finding work is really key. They also focus on direct links with employers so that trainees and participants get jobs, and they focus on recognizing that it isn't workers only that need to be trained or that need to evolve to meet industry need. It is industry sectors that also need to evolve and change to become more inclusive and more equitable. And so to the extent that we find these partnerships, the state is making very large investments in supporting industry with the changes that they are requiring and in finding the workers that they need. I also want to sort of emphasize this key principle of worker voice and why it's at the heart of these high road training partnerships. So employers and industries want to attract the best workers, the best trained workers. And there has been a bit of a seismic shift in their understanding that in order to attract the best, they also have to offer that voice in the workplace, that input of the worker in how they want to grow and be part of a business or a sector. I also want to just very briefly touch on, high road also can mean, in most cases, a higher cost in our investments, because we've learned over the years that in order to break inequity truly, by providing equitable access to our programs, equitable experience and the ability to complete those programs, and then equitable outcomes, we need to focus on all of these components that support workers. It's not just anymore about training in and of itself. So the second question I was asked was to describe how all of this connects with our work on a just transition, as well as reducing vulnerability and building greater climate resiliency for workers, especially given our health challenges, our climate challenges. And so I wanted to answer this question first by really stating affirmatively and very pointedly that at the heart of supporting climate resiliency and a climate resilient economy is building a resilient workforce and resilient workplaces. So we take everything that I just talked about in terms of enforcement and workforce development, and we apply it more specifically to this question. So I think first, we think about how we protect workers that are impacted by severe heat, by wildfire smoke, so that they can remain at work safely, and so that we can minimize operational disruptions for businesses as well. Sectors that we focus on are construction, transportation, warehousing, logistics, and of course, agriculture, where some of our most vulnerable workers exist and face these very real climate risks. And I also want to emphasize that workers in the state die every year on the job, not just from injuries on the job, but specifically from extreme heat. And while we fare better generally than the rest of the country on average, we have to do better. And we can do better with this renewed focus from workforce and labor agency on this issue. So when we think about ag specifically, and so I'd like to hone in a little bit on agriculture, we have sort of all these challenges that come into place. We have near zero voice for workers. We have workers that are the least likely to file complaints and let us know that something is wrong. And so this idea of working closely with community-based organizations and other advocacy groups on the ground is extremely important for us, because that's how we are able to communicate and empower workers to understand their rights in the workplace when it comes to things like extreme heat. And it also allows those community organizations to serve as a voice and file complaints on behalf of those workers. I think also in the enforcement space, and when we think about ag, it's really important to realize that it takes a village. It really does take a village. It's not just community-based organizations and unions and advocacy groups. It really takes collaboration with our sister agencies to identify where the greatest challenges are. And it also really takes a lot of work with industry to educate and to bring them along this pathway of providing the right safeguards for their workers. If we move to the topic of workforce development, and we think about ag specifically as well, this second strategy of workforce development, it supports both the creation of the resilient workforce and a resilient industry. And it's about creating focus and strategy in these sectors that are threatened by serious climate change impacts. So I will continue to talk about ag here because it really is an industry where so much is happening and a lot of these challenges are starting to come together. So from the industry perspective, we hear that there is quite a bit of an existential crisis happening in the agricultural sector. And it's not only caused by drought and other climate impacts. There are worker shortages, which is really not surprising since these are extremely difficult jobs with a lot of health risks and not well-paid jobs. They are jobs that offer very limited voice to these workers. And to top it all off, the industry is now facing rising costs of everything to run this industry, from gas, other energy costs, materials, and they don't necessarily have the chance to just raise the price of their products in order to cover those costs. So there's a confluence of a lot of factors which are challenging, but which I believe provides an opportunity for us to really insert some changes in how the industry looks at the workforce and voice for their workers. So the industry is recognizing that it has to look different in order to address these challenges. And we're seeing or hearing a lot about
dificultades. Estamos oyendo mucho acerca de la transición de agricultura para que sea más tecnológicamente en los campos y haya más una especialización de los cultivos y orgánicos. En todo esto requiere una fuerza laboral que sea más talentosa o con más entrenamiento. Y si no nos encargamos de la parte de laboral, de la fuerza de trabajo, entonces esta industria todavía puede caerse incluso con todas las otras, si se cumplen con otras necesidades transicionales. Así que nuestro rol es poder agarrar estas inversiones, agarrar estos valores y ponerlo, aplicarlo en este sector en particular, apoyar a la industria y también aumentando la escala y cumpliendo con las demandas, siempre y cuando también se está proporcionando el precio adecuado para que ellos puedan tener una voz. Y así, Como un Estado, nosotros vemos la vista de que nosotros queremos invertir, queremos apoyar, pero también queremos ver que el sector cambie de una manera significativa. Y finalmente, para poner a estos trabajadores en el centro, en lugar de mantenerlos en los márgenes, como lo hemos visto por décadas. Últimamente también quería mencionar acerca de los trabajadores, de sacar a estos trabajadores tanto en la parte de la agricultura como en la parte del entrenamiento. Es importante, los impactados por el cambio climático es tan importante porque han habido muchas pérdidas de trabajos y tenemos una vista en particular de cómo el Estado se involucra en este proceso y ya sea se alinea muy bien con el espíritu de servir y también las asociaciones. Lo importante para el Estado es que mientras que vamos poniendo las pólizas, puede crear el cambio en las industrias piden al Estado que les dé las respuestas. Y cuando les pide la respuesta acerca de cómo se va a ver esa transición, cuál va a ser la siguiente industria, cuál va a ser la bala plateada que va a afectar a todos estos sectores. Entonces, las comunidades, cuál va a ser, debería ser la transición. Las regiones, todo debe ser los creadores de la economía en el futuro y son responsables por esta creación y nosotros estamos, lo que a nivel estatal es nuestra responsabilidad, tenemos que apoyar con los recursos y las pólizas que apoyan esas elecciones de transición y siempre y cuando las comunidades están involucradas y no solamente acerca de las de no emisiones o también de los de las elecciones de transición, pero a través del crecimiento económico y el éxito que se ha visto a través del Estado. Así que esto es un par de pensamientos acerca de cómo estamos viendo los asuntos de la inequidad en el lugar de trabajo y cómo planificamos investigar, apoyar la transición de las
to the extent that they want to also be inclusive and break inequity, primarily by increasing worker voice in the workplace. I really appreciate the time here today, and I want to thank everyone again.
Thank you so much, Secretary, for providing those very comprehensive framing and the statewide context for today's discussion. So really appreciate your sharing your thoughts and speaking with us today. So moving on to our next presenter, we have Amy Heinzerling, a public health medical officer with our State Department of Public Health Occupational Health Branch, where she currently works on topics including COVID-19 in the workplace and addressing heat-related illness among California workers. I'll turn it over to you, Amy.
Thanks so much. Thanks very much for inviting me to join you here today. Today, I'm going to share with you some of the work that we've done at CDPH trying to characterize one of the major climate-related risks faced by California workers, heat-related illness. Next slide. As most of you know, workers who typically have
Los
little
trabajadores que tienen poco control sobre su ambiente laboral son susceptibles a enfermedades causadas por el color, especialmente aquellos que no están controlados del clima y que no usan equipo de protección personal. Y como ustedes saben bien, el cambio climático aumenta las temperaturas globales.
Both of these changes place everyone, including workers, at increased risk of heat illness. Next slide. Heat illness is, of course, however, preventable. And California is one of only 3 states with an occupational regulation that's specifically designed to protect workers from heat illness, which you'll hear a bit more about from Cal OSHA in a little while. Passed in 2006, the regulation requires employers to provide outdoor employees with training about heat illness, as well as access to water, shade, and rest. Next slide. Despite this, we actually have pretty limited information about the burden of occupational heat illness in California, or about which groups of workers may be at particularly high risk. In California, most work-related injuries resulting in workers' compensation claims must be reported electronically to the Workers' Compensation Information System, or WCIS. We were interested in whether these data could be used to give us more information about occupational heat illness in California. Next slide. Using this workers' compensation data, we set out to do a few things. First, to calculate rates of heat illness in California. Second, to assess trends in heat illness over time. And third, to identify risk factors for heat illness in order to help inform prevention efforts. Next slide. In order to do this, we searched over 13 million WCIS claims from 2000 to 2017 in order to identify workers who'd experienced heat illness. We then estimated rates of heat illness by dividing the numbers of workers with heat illness by the total number of workers employed in California over the same time period. In order to determine risk for specific industries and occupations, we assigned standard industry and occupation codes to each affected worker. So what did we find? We identified nearly 16,000 cases of heat illness among California workers from 2000 to 2017, or an average of 6 cases per 100,000 workers per year. Next slide. This graph shows annual rates of heat illness per 100,000 workers. As you can see, the lowest rate was seen in 2000, while the highest was seen in the most recent year we analyzed, 2017. We also saw a spike in 2006, which was both the year that California's heat standard came into effect, as well as a year in which a major heat wave affected California. Next slide. Here we show total number of heat illness cases by month of occurrence. Unsurprisingly, most cases occurred during summer months, with the highest number of cases seen in July. Next slide. Here, looking at rates of heat illness by gender, you can see that the rate of heat illness among male workers was over 2 times the rate among female workers. Next slide. Looking at rates of heat illness by age group, we saw that workers aged 16 to 24, the youngest group of workers, had the highest rate of heat illness, which was nearly 2 times the rate among workers 65 and older. Next slide. This slide shows percent of heat illness cases by time since the worker was hired for all illnesses that occurred within the first year of hire. Nearly 9% of cases occurred within 2 weeks of hire, and nearly 3% occurred on the worker's very first day on the job. Next slide. This slide shows rates of heat illness by county. In California, Imperial County had the highest heat illness rate of nearly 37 cases per 100,000 workers. Second highest was San Diego, followed by Los Angeles. Next slide. Here we show rates of heat illness by industrial sector. The highest rate of heat illness was seen in the agriculture, forestry, and fishing sector. The second highest rate was seen in the public administration sector, which includes many public sector employees, including firefighting and police forces. Next slide. Here we take a closer look at the industrial sector with the highest rate of heat illness, agriculture, forestry, and fishing. 12% of workers we identified with heat illness worked in this sector. And within the sector, nearly 3/4 of workers worked specifically in the crop production industry. Next slide. One somewhat surprising result was the above average rate that we saw in the administrative and support services sector, which is not necessarily a sector that we traditionally think of as associated with heat illness. Nearly 7% of all workers with heat illness worked in this sector. And within this sector, nearly half of affected workers work specifically in the employment services industry, which includes temporary employment agencies. Next slide. Here we show rates of heat illness by occupational group. Protective service occupations had the highest heat illness rates, while farming, fishing, and forestry occupations had the second highest. Next slide. Within the group with the highest rate, protective service occupations, 2 individual occupations stood out. Firefighters had the highest heat illness rate of any individual occupation, and police officers had the next highest rate among protective service occupations. Next slide. As we all know, heat illness is preventable.
Esta enfermedad de calor se puede prevenir, entonces debemos tener prevención al permitir que los trabajadores se aclimaten al calor. y darles capacitación adecuada acerca de calor. Y a pesar de esto, y a pesar de que California tiene mucha protección a nivel nacional para evitar esta enfermedad de calor, claramente tenemos mucho más que hacer. Nuestros resultados y nuestros trabajadores jóvenes tienen mucho alto riesgo y también los trabajadores que son hombres. Y los sectores más afectados son los de agricultura y los bomberos. Siguiente diapositiva. Con base en estos estudios vamos a trabajar en los próximos pasos. Muchas de sus organizaciones ya hacen muchos esfuerzos de alcance con los trabajadores y queremos seguir trabajando sobre esto y seguirnos asociando. Y esperamos poder identificar a estos trabajadores con mayor riesgo y podamos dirigir nuestros esfuerzos para asegurar que los empleadores cumplan con esto.
Trend that we're seeing in heat illness over time and the continued rise in temperatures that we expect in the coming years. We're looking into establishing more systematic public health surveillance for heat illness in order to give all of us the information that we need for timely action to prevent heat illness in California workers. Next slide. Thanks very much for having me. I just wanted to thank a few of the other folks who made this work possible. And I'm happy to take any questions now if there are burning questions or at the end when we have a larger discussion. Thank you.
Thank you so much, Amy. And just to kind of keep things moving, we'll address any burning questions in the chat, but otherwise we'll save the main discussion and Q&A at the end. So really appreciate it. So our next presenters comprise of a group. So I'll go through each of the speakers individually first and then turn it over to them. So Yasmin has lived in Oxnard for over 15 years. She works with the strawberry and tomato industry and has been a volunteer with Líderes Campesinas for 2 years. Josefino has been working in Ventura County for over 20 years. He works on strawberries and grapes in hot weather, rain, and cold. Despite this, he continues to work for his family and to bring food to the community. He has been a volunteer with MyCop for 2 years. Next slide. Claudia is the coordinator of programs for interventions to end violence against women and organizer for the Ventura chapter of Líderes Campesinas. She has been with the organization now for 5 years. Eulalia has been a volunteer with MyCop since 2019 and is now their environmental emergencies organizer. Isadora is a research associate with Tracking California program of the Public Health Institute. She graduated with a Bachelor of Arts in Environmental Policy and Latin American Cultures and has been working with the Achieving Resilient Community Project since spring of 2020. So I will go ahead and turn it over to you all. Thank you. Take it away.
Gracias. Gracias. Mi nombre es Claudia Quesada. Soy coordinadora de programas con la Organización de Líderes Campesinas. Hoy vamos a presentar el equipo sobre lo que es la justicia climática para los trabajadores agrícolas aquí en el condado de Ventura. Justicia climática es en colaboración entre varias organizaciones como lo que es MyCap, Líderes Campesinas, el Instituto de Salud Pública y Causa. Gracias. Adelante, por favor. Aquí en el condado de Ventura, la producción entre la industria es de más de 2,000 millones de dólares al año, lo que reproducen nuestros trabajadores agrícolas. Y queremos enfatizar que solo esto forma aquí en el condado de Ventura y tenemos alrededor de 41,600 trabajadores agrícolas. Y este es nada más un estimado, porque sabemos que hay más comunidad que todavía sigue llegando, pero por alguna razón todavía no se muestran en las estadísticas, ya sea porque todavía no se hacen contar en el censo o en las clínicas, pero sabemos que hay más, ¿verdad? También sabemos que hay un alrededor de 25,000 residentes de la comunidad indígenas que vienen del sur de México. Esto es más sobre la comunidad indígena que viene más sobre lo que es el estado de Oaxaca, Puebla y Guerrero. Son los 3 estados que se caracterizan más aquí en el condado de Ventura sobre la comunidad indígena y también diferentes
And then there are also
de las comunidades indígenas que residen
in these indigenous residents, there are several types. And we also know that in the statistics that 30% are women.
de trabajadoras agrícolas aquí en el condado de
There
Ventura.
are 30% are women farm workers.
A la siguiente, por favor.
Can we move on to the next slide, please?
Creo que ya. Y aquí me gustaría
And here I would like to let Jasmine take over, who's going to tell us about.
Adelante, Yasmin.
Hola, buenas tardes a todos. Soy Yasmín, estoy voluntaria con Líderes Campesinas. Un poco de mi historia, pues como ustedes acaban de mencionar, trabajo en la fresa y en el tomate. En el último año, en el 2021, estuve trabajando en la cosecha de tomate. Empezamos nuestra jornada como todos los días, solo que este día iba a ser diferente. Las temperaturas llegaban a 95 grados. Empezamos a trabajar. Una de mis compañeras salió a tomar agua y de repente me dijo que le dolía la cabeza. Le dije que tomara un poco de descanso, pero dijo que a lo mejor le iba a regañar el surquero o el supervisor si la miraba sentada y no estaba trabajando. Seguimos con la jornada, salimos al lonche y ella seguía con el dolor de cabeza. Estaba con su abuelita y de repente miramos que se desmayó, de repente cayó. Al ir corriendo, gritamos al surquero a pedir ayuda. Lo que hicimos fue quitarle los paños y echarle aire, pero en el momento ella empezó a convulsionar, empezó a temblar su cuerpo. Lo que hicimos fue tratar de sacarla para echar un poco de aire y llamar a la ambulancia. Pero estábamos trabajando en Somis, en Fillmore. Ahí es prácticamente que está aislado, hay muchos árboles y está como en hoyo. Entonces, la ambulancia fue realmente difícil, tardó para llegar. Tratamos de sacarla. Cuando salió la muchacha, llegó la ambulancia. Lamentablemente, su cerebro estaba muy caliente, su sangre estaba hirviendo. Al sacarla, cuando ella cayó, se le reventó una vena del cerebro de tan caliente que estaba su sangre y pues las temperaturas estaban demasiado calientes. No supimos si ella tenía algún problema cuando cayó, si se haya pegado con una estaca o también por lo mismo de que estábamos adentro de los surcos y no había ventilación, ella se asfixió. Entonces ella lamentablemente murió en el transcurso de la ambulancia. El pronóstico del doctor fue que ella no resistió porque su dolor era muy fuerte, su vena no aguantó, su sangre estaba caliente, pues las temperaturas.
Blood was really hot because the temperature was really high. So this was something really hard for us. We had never experienced this. And we didn't, there were a lot of us women, but there wasn't enough wind or shade. And the only one shade we had were the shade from the tomatoes. So we didn't have this available to us. And so what I ask is for there to be change so that there are no more deaths. And also, as a result of this, there have been fires and the smoke. We've been working with everyone. They usually have allergies and their eye allergies.
Alrededor.
Because because of these fires, and we don't have face masks.
También unos de mis compañeros
And
sufren de
also, some of my colleagues have suffered from asthma because we have had to work, and we have to work under these high temperatures, and when there's rain,
nada, pues que
and we don't have anything that can help us.
quiero que haya cambios
I really ask that there be changes for us.
para toda la gente. Y pues sé que hay mucha gente que ahorita tiene problemas médicos en los pulmones por absorber todo esto, lo que viene siendo el humo. Entonces, pues es todo de mi parte.
So that's all I had to say.
La palabra a mi compañera Eulalia.
So now Eulalia can talk.
Gracias, Yasmin. Buenas tardes a todos. Muchas gracias por estar aquí, por permitir su tiempo de estar aquí. Nosotros hemos trabajado desde hace un año. Yo he sido voluntaria con Alianza de Resiliencia Comunitaria, de una visión del poder del cambio en las políticas para la resiliencia climática.
Hola, perdón por interrumpir. Creo que esta es mi diapositiva y la suya viene próximo. Perdón.
Adelante, Isadora. Sí, eso pensé.
Ok, gracias. Y gracias, Yasmin, por compartir su historia. Hello, everyone. I'm Isadora Noguera. I'm a research associate with the Tracking California program of the Public Health Institute. Next up, we have Josefino Cervantes and Eulalia Natividad Mendoza, who will both be sharing their digital stories about heat in the workplace. However, first I wanted to give some background on the origins of our collaboration and the stories you're about to see. These digital narratives grew out of a series of fortunate events. Last year, Story Center, an organization that uses storytelling and participatory media for reflection, education, and social change, reached out to Tracking California to see if we were interested in producing autobiographical videos about the impacts of climate change on the lives of California residents. It just so happened that we had been working with farm workers on the Achieving Resilient Communities project in Ventura County since 2020, and had just led a series of focus groups in Mixteco and Spanish, as well as 3 trainings with MyCop and Líderes Campesinas, and we're then launching a summer informational campaign on workplace rights related to heat and wildfire smoke. We thought it was a perfect opportunity to highlight the stories we've been hearing from farm workers and move from power building to policy change. Thank you to Cigna, our funders, for supporting our technical role in this work, and CDPH for covering the cost of these videos. Thank you to everyone for the opportunity to share this work, and you can read more about our project and watch the other 4 wildfire and smoke videos at achievingresilientcommunities.org. Eulalia, and next slide. Perdón, en realidad es Josefino primero.
Muy buenas tardes. Mi nombre es, ¿sí me escuchan?
Sí, lo escuchamos.
Muy buenas tardes. Mi nombre es Josefino Cervantes y soy del estado de Oaxaca. Mi pueblo se llama San Martín Durazno. Llevo más de 20 años trabajando en el campo aquí en el condado de Ventura y más de 2 años siendo voluntario de un líder comunitario aquí en Nico o el proyecto Mixteco. Y muchísimas gracias por invitarme, por estar aquí. Pues no pensaba mirar tanta gente, pero creo que somos bastante y estoy muy contento de estar aquí. A contar un poco de mi historia, la verdad que trabajar en el campo es muy difícil porque a veces para nosotros los campesinos no hay días festivos, no hay día que digas que cuando haya viento, aire, calor, lluvia, y tenemos que trabajar para estar con nuestra familia y para llevar la comida a la comunidad, más que nada. Y como ahorita ando trabajando en La Mora y es como invernadero, si por ejemplo está a 90 de calor y adentro de la casita están 10 de más, es demasiado calor para soportarlo todo durante el día y tenemos que tomar mucha agua, tenemos que salir cada rato a tomar aire. Más que nada por el lado del SOMI, Morpha, es la parte donde hace más calor y hemos trabajado en varios lugares y está muy caliente. Más que nada, las mujeres que embarazadas son las que corren más riesgo de andar trabajando porque hay mucho calor y la verdad que es un sufrimiento de andar en el campo, más que nada en
out here on the field. And also,
hasta a veces
the sun rays all really do affect us, and we feel it's too much heat, and we still have to go ahead and work to be able to pay our rent, to pay for our food, and provide for our family, especially for the community, because we want to change, and we hope that this change is so much needed so that we can have more water. We ask that the employers be
más a sus trabajadores, a que no haya muerto, que por la situación del calor, más que nada, porque somos gente inmigrante y tenemos familia y tenemos que
and we have to work, and they really don't care if it's so hot, but we're working to be able to provide for our family. And the truth, it's really sad to try to work in the field. It is really hard work. I know that things aren't always easy, but we appreciate this for letting me be here and being able to see people from different places. And I hope that you can help us to be
cambios en nuestro trabajo, más que nada. Y ojalá que haya más sombra, ojalá que esté más pendiente de las personas, que no haya muerto por el calor, por el aire, por la lluvia, por lo que sea. Y muchísimas gracias. Como han visto mi foto del video que hice, es muy fuerte de andar trabajando en el campo. Pues, muchísimas gracias por invitarme y estoy muy contento de conocer muchas personas y le agradezco de todo corazón. Muchísimas gracias y es todo.
Gracias, Josefino. Sorry. Trinity, could you pull up his video?
Yep, I will start it right now. Thank you.
Mi nombre es Josefino Cervantes. Yo vengo de un rancho un pueblillo muy chiquillo. Tengo mucho tiempo trabajando en el field, pero este año me tocó ir a un lugar más caluroso. Casi todas las semanas hemos ido al lado de Morpar, allá es donde hace más calor. Ayer, por ejemplo, todos estaban sudando demasiado. Gracias a Dios que no nos ha tocado las personas que se sientan mal en nuestra cuadrilla. El surquero siempre nos dice que tenemos que tomar agua por la mañana. Pero igual casi no aguantamos el calor y a la misma vez tenemos que echarle gana para poder salir adelante. A cada ratito salimos a tomar agua o estar un rato afuera. Tomamos mucha agua. Igual es muy doloroso de estar allí porque casi no aguantamos por el calor. Soy uno de los que se aguantan en el calor, pero si vamos a seguir a ese lado del Morpar donde hace más calor, me cambio de la compañía o me sigo en la misma compañía, pero hacia para Osnar. Este año me enfermé con el COVID. Estuve al hospital 20 días. Caí pero muy bajo. Pensé mucho cómo valorar las personas que tengo a mi lado, cómo valorar la gente y cómo quererla. Yo les digo a mis compañeros, si se sienten mal, avísenme para poder ayudarlos. Con gustos los voy a ayudar porque hay cosas que me han pasado a mí igual. Doy gracias a Dios que aquí estoy con mis hijos, con mi esposa y con mi hija. Mi nombre es Josefino Cervantes, soy el trabajador del campo y ahorita es temprano y ahora tengo chance de grabar un poquito, es lo que estoy piscando. Estamos en invernadero, aquí es cuando hace mucho calor, el tiempo de calor. Y como ahorita es temprano, ya estamos calientes, ya está empezando a dar calor. Por eso estoy haciendo este video y ojalá que sirva para algo. Muchísimas gracias.
Profundo agradecimiento a los participantes del taller y su contribución a nuestra comprensión de los efectos de cambios climáticos sobre la California. Gracias por la cooperación de las siguientes organizaciones y programas: Líderes Campesinas, Proyecto Indígena Mixteca, Alianza de Resiliencia Comunitaria, Causa. Gracias a los siguientes programas del Instituto de Salud Pública, apoyo financiero de Stigna Foundation, American Public Health Association y los Centros para el Control y la Prevención de Enfermedades.
Hola, buenas tardes a todos. Muchas gracias por estar aquí. Mi nombre es Eulalia Mendoza. Yo soy una trabajadora. Tengo 22 años trabajando en los campos agrícolas del condado de Ventura. Desde hace un año fui reclutada para trabajar para MICOT porque hablo una lengua indígena y cuando se tenía que proveer información a la comunidad indígena que habla un idioma allá afuera en los campos agrícolas, fui reclutada para trabajar aquí y tengo un año trabajando con ellos, pero quizás en un año regreso otra vez a trabajar en el campo. Ahorita van a mirar un video de lo que es mi historia y espero que cuando ustedes miren este video, ya que veo muchas personas que están conectadas y queremos en nombre de todos los trabajadores, así como yo que llevo 22 años en los campos, hagan conciencia y vayan más allá para que puedan hacer visión de cómo
They could be, we want this to be just a way to awaken everyone so that we can all work together to see how we can work on this so that we can continue to work and help my community that is out there. I'm going to share the information. This is in English and Spanish, but it is not in any other language that they can understand. So we're going to watch the video.
Can we pull up Eulalia's video?
Me llamo Eulalia Natividad Mendoza. Yo desde los 8 años he trabajado en el campo. Sé recolectar todas las verduras y todas las frutas. No hay un trabajo que no he hecho. Mi mamá siempre me decía que era bien cuerda. No importaba qué tan difícil fuera un trabajo. Yo lo resistí. Mi actitud es yo puedo, yo puedo, yo puedo. Dejé de ir a la escuela el tercer de primaria, pero aprendí a leer sola. Si me tocaba despedirme de alguien, yo no lloraba, aunque por dentro me desgarraba, yo me aguantaba. Mi último trabajo fue un invernadero donde el calor es demasiado fuerte. Si afuera hace 80 grados, adentro sube 15 más, hasta 95. A mí se me hacía fácil seguir trabajando y no prestarle atención a mi cuerpo. No me di cuenta que me estaba insolando. Dejé de sudar, después empecé a sentir la boca seca y me empezó a doler la cabeza y a dar náuseas. Pensé que a lo mejor se me había bajado la presión o a lo mejor era mucho calor y no lo podía soportar. Seguí trabajando, pero cuando ya pasó como una hora de que la boca estaba seca, ya no estaba sudando. Le pregunté al mayordomo por qué el invernadero se estaba poniendo amarillo. Me dijo, ¿te sientes bien? ¿Te duele la cabeza? Cuando ya no das más, te sacan para afuera para que te recuperes. No soy la única que se arriesga la vida. Me pagan por pieza, así que no puedo dejar de piscar o no me pagan o no me sale lo del día. Todavía sigo trabajando duro para mis hijos, para mantener a mi mamá que ya no puede trabajar, pero también siento que tengo que hablar por mi comunidad y decir que no es justo cuando hace calor y estamos poniendo nuestras vidas en peligro cada vez que vamos a trabajar. Esto pasa en la mayoría de los casos, todas las personas que trabajamos en el campo. Alguna vez hemos pasado por una insolación y por vergüenza a decirlo o te pueden despedir de tu trabajo o por mantenerte en tu trabajo te quedas callada. Así que mi recomendación y consejo es para todas las mujeres jornaleras, para todas las personas que trabajan en el campo, cuando empiecen a sentir calor o empiecen a sudar o tener náuseas, es síntomas de una insolación. Así que repórtenlo inmediatamente y cuídense porque vida es ahí solo una, trabajo siempre va a haber. Gracias.
Muchas gracias a todos. Ese es realmente lo que pasan los jornaleros día a día allá afuera. Los dejo como algo, yo platiqué mi historia real de lo que me pasó, pero así como me pasó a mí, cuántas personas trabajadoras del campo, mujeres, hombres que están allá afuera, que no saben leer ni escribir, que no conocen su derecho, les da pena decir, pasan por eso. A los patrones no les interesa si nos enfermamos o no. Ellos solo les interesa sacar su trabajo adelante y no les interesa nada más. Si te llegas a dar insolación, te sacan para afuera, descansas un rato y te mandan para tu casa. Ellos lo que no quieren es que mueras en el trabajo, ellos lo que quieren es que te vayas y te mueras en tu casa. Esa es la realidad. Gracias.
Next slide. Eulalia, también creo que si usted podría hacer esta.
Sí, gracias Isadora. Cuando empecé a ser voluntaria con MICOT, el primer proyecto en el que participé fue de Alianza de Resiliencia Comunitaria con un grupo de enfoque, en la cual donde preguntamos a las personas cuáles eran las ideas, cómo les gustaba recibir las alertas, cómo se sentiría más cómodo. En este grupo de enfoque, en todo lo que hicimos, ellos optaron por un sistema de audio. ¿Por qué optaron por un sistema de audio? Porque la mayoría de las personas allá afuera no saben leer ni escribir. Y los poquitos que saben leer no saben navegar un sitio web. También vimos que la mayoría no saben hacer una queja calosha. ¿Por qué? Porque el proceso de queja son demasiadas complicadas por sitio web. También quieren que se mejore el proceso de quejas. Queremos que se mejore el proceso de quejas. ¿Por qué? Porque muchas veces se hace una queja, pero realmente cuando van a llegar a inspeccionar, la compañía ya sabe qué día van a llegar, cuánto van a llegar, quiénes van a llegar. Y ya limpian todo. Si, por ejemplo, es de calosha, los baños los limpian, los lavan, le ponen papel, le ponen cubreasiento, todo. Está limpio. Cuando llega la inspección, ya estaba todo limpio, pero se va a la inspección y vuelve a ser lo mismo. Las normas para prevenir el calor en los invernaderos, pues es imposible porque los últimos, no podemos hacer nada trabajando ahí porque los invernaderos son de plástico y es demasiado caliente. Así que lo que queremos ver, cómo ustedes trabajarían para mejorar con los granjeros, con los patrones, para que ellos puedan proveer más acceso a sombra o hablar con las personas que salgan a tomar agua. O cómo darle la información, porque realmente la información no les llega. Cuando llegas a trabajar los 22 años que llevo trabajando en el campo, cuando llegas a trabajar en una compañía, jamás te dicen dónde puedes hacer una queja. Jamás te dicen qué es calosha, qué es la ley laboral, qué es el comisionado laboral. Nunca tenemos esa información. Un lugar privado para descansar. ¿Por qué? Porque cuando descansas y te sientes mal y sales a descansar, pero ahí están todos tus compañeros, todo te está mirando. Empiezan a burlar de ti diciendo, ya le dio flojera trabajar, no quiere trabajar. Entonces nos gustaría que hubiera un lugar privado para descansar. Eso no me refiero a que me hagan un cuarto especial o a que yo me vaya solita por
So room so that I can go there by myself, but maybe it would be a little more separate from the other coworkers, and also like expanded emergency response and training and protocols, because
adentro, lejos, y no sabemos la dirección, jamás sabemos la dirección, así que queremos que los patrones digan las direcciones, que nos capaciten a los mayordomos, que le avisen las direcciones, el lugar donde estamos trabajando, cómo, si en caso de una emergencia, cómo hacerle para que la ambulancia llegue más rápido y no pase a muerte. No es la primera muerte que ha habido, son muchas, pero eso jamás se le reporta a ustedes. Son muchas, no es la primera muerte que pasó en el 2021. En el transcurso de 22 años que llevo trabajando, yo he visto muchas muertes, muchísimas. Y eso creo que nunca les ha llegado a ustedes, porque como le digo, a ellos no les interesa que mueras ahí. Te sientes mal y te mandan para tu casa y te mueres en tu casa. Después, no sabes qué pasó porque todos los papeles que te dieron están en inglés, lamentablemente. Gracias, muchas gracias.
Thank you. That's the end of our presentation. But thank you to our funders, Cigna, CDPH, APHA, Centers for Disease Control and Prevention, as well as Story Center for creating the stories, and our ARC project team members at the Public Health Institute, and our Farm Worker Leaders Advisory Committee in Ventura County.
Gracias todos. Thank you so much for the entire group, particularly Josefino and Eulalia, for sharing your stories powerful and personal, and all the work you all are doing in raising awareness and working towards change for greater health protections. I see we have a question or a few questions on the chat, so continue to send those in, and we'll plan to address as many as we can during the question and answer session. And other speakers, feel free to put in any answers in the chat if you are able to. So moving on to our next presentation, we have Tim Shattuck, who is the legal director at the Warehouse Worker Resource Center, a nonprofit organization dedicated to improving working conditions in the warehouse industry in Southern California, where he leads the organization's direct legal services and provides strategic counsel on policy and organizing campaigns. Tim was previously a staff attorney with WorkSafe and began his legal career in the U.S. Department of Labor's Office of the Solicitor. Take it away, Tim.
Thank you, Dan, and thank you for having us. It's really great to participate in this discussion, and really, very humbling and powerful to follow the prior presentations. I think we all owe the farm worker organizers and workers a huge debt, because it's really their fight and their struggle that has led having any kind of protections against heat in California, and including whatever we've been able to have in our industries as well. So we're extremely grateful for that that fight and that courage. So as Dan said, I'm with the Warehouse Worker Resource Center. We're based in Southern California in the Inland Empire region, which is San Bernardino and Riverside counties east of Los Angeles, in Ontario. And we can go to the next slide, thanks. We've been around for a little over 10 years and have been working directly with warehouse workers throughout that time, with thousands of warehouse workers fighting for their rights in terms of fighting against wage theft, health and safety, other issues. And heat hazardous heat illness has been one of the most central fights that we've had throughout that time, which I'll talk more about in a minute. But first, I wanted to talk a little bit just about the warehousing industry. If we can go to the next slide, please. Because I think sometimes when I talk to folks outside of the industry, it can be a little bit of a unknown for folks about what is the warehousing industry. I think sometimes people think of warehousing as just storage, where we have goods sit for a while. But it's important to understand that the warehousing industry is really the goods movement industry. It's part of the supply chain. It's about actively and quickly moving goods from their source to the retail or customer's location as quickly as possible. So it involves a lot of packaging, repackaging, sorting, and distributing of goods. And so it's actually, these are very busy, active workplaces. And as you may or may not know, California is actually one of the most important locations of warehousing in the US, certainly, and even in the entire world. And that is because, in particular, in Southern California, of our proximity to the ports of Los Angeles and Long Beach. About 40% of containerized goods that come into the US come through that port system. And so over the past 20 years or so, as we have increasingly imported a lot of our goods in this country across the Pacific,
el Océano Pacífico, hemos tenido el crecimiento y también hemos tenido un aumento en el depósito de almacén, especialmente en el Inland Empire. Y entonces aquí, entonces, por ejemplo, aquí vemos, y también por las escuelas y alrededor de las comunidades. Entonces, dependiendo cómo lo cuenta, a veces más de 200,000 trabajadores de depósitos solamente en el sur de California. Y es importante saber que más o menos 40% de estos trabajadores del área trabajan siendo el personal de agencias y con suerte o con frecuencia experimentando acerca de este entrenamiento, y también donde a veces ellos han sufrido una entonces también es
claims because
Y
of how many.
también dependiendo de cuántos trabajadores están pasando a través de las agencias de empleo. Así que es importante saber que esta ingeniería está dominado por simplemente por vendedores mayores como son Amazon, y estos simplemente son firmas logísticas, y estamos hablando de los lugares donde parte de estas compañías gigantes que tienen suficiente dinero para poder hacer esto, regular lo del mercado de los trabajadores. Y también la mayoría de los trabajadores de depósitos en California son gente de color. Más del 50% de los trabajadores son latinos o morenos. Y entonces vamos a pasar a la siguiente diapositiva.
Like I said,
Así que,
and this
como
is just a
dije,
quick map
y
of
esto es
warehouse.
solamente algo rápido que iba.
That we don't have to linger on it, that it kind of is this band that extends from the port out east. Like I said, going back over 10 years from our work organizing directly with warehouse workers, heat illness in warehouses was one of the biggest issues that has come up consistently. I think it's really important to highlight warehouses because I think often we think of heat illness as maybe happening primarily in outdoor workplaces where workers are exposed to the sun and elements. And I think while it may often be more severe in those contexts, the reality is that workers in warehouses and a lot of other indoor workplaces are really not very well insulated from the environment. We see in Southern California, right, if you think about that map, a lot of these warehouses are in the IE, where if you've been there, it's very hot in the summer. For much of the year, the temperature is in the 90s or higher. And we see in a lot of warehouses, the temperature inside during the day is just as hot inside, sometimes even hotter, because these warehouses are, basically tin cans that are just baking in the sun. A lot of them are not very well insulated, so they get really hot, and a lot of them don't really have very adequate climate control. They maybe don't have air conditioning, might just have fans, and don't have very good, placement of fans to keep workers cool. So we see, really high temperatures. This graph here on this slide is from a study that KQED in the Bay Area did a couple of years ago, where they actually had a worker take in a sensor inside a warehouse that measured the heat index throughout their shift. And you see this kind of line at the bottom is 90 degrees heat index. So for most of their shift, they're working in heat index above 90 degrees, sometimes up to here about 115 degrees. And this is not like some just, kind of low road warehouse. I won't say where, but this was a major retail brand warehouse, high-tech, large warehouse where this was happening. And this is sadly very typical. So because of that, we've seen over the years, many warehouse workers in the summers are getting, sick, passing out on the job, experiencing heat illness. We suspect in some cases, potentially even dying from heat illness in these kind of conditions. And we see also that unfortunately, a lot of employers are not recognizing or responding adequately to the heat illness issue. I think, they don't, when we've, there's examples we have of, workers passing out in, like, say, an outdoor area, and employers will just hold a piece of cardboard over them instead of, calling the ambulance. I think similar to what some of the prior presenters were saying, we see the same thing where employers don't want workers sick at work. They don't want the responsibility for that. So when workers present with heat illness symptoms, they're often just told to go home when really they're having potentially a medical emergency and they should be getting medical care right away. And we've seen that happen where workers are told to go home and they end up in the ICU later with heat stroke. So there's these really inadequate protections and responses to heat illness often when it presents. We think it's also often really undercounted, and that in most of our experience, we don't see workers' comp claims being filed around this. That again, employers are not treating it as a workplace illness. They're just saying, oh, go home. And then workers often don't know about their rights, or sometimes even don't know to recognize the illness with its symptoms. And so that's part of our work too, is to try to provide some of that training and that enforcement too with employers who don't follow those rules. We can go to the next slide. I think I'm running short on time, so I'll just mention briefly that this presentation today was mentioned sort of the context of learning from COVID. Just to say that we saw during COVID as well, warehouse workers, according to at least one study by our partners at UC Merced had the highest increase in COVID-related fatalities during the pandemic of any industry. That's because we had huge outbreaks in warehouses and really inadequate employer responses. Next slide. And that's, I think it's a sort of chilling lesson for what we can expect moving forward in warehousing with climate change, with heat getting worse, as we have these warehouses are very, difficult to access settings where the employer has a lot of control. And so unless workers organize and take action, there's not a lot that gets changed. The employers are not, we're not seeing them affirmatively implement measures to protect workers from COVID or from heat illness. And it's really difficult for agencies like Cal OSHA, even though they've done a great job on a lot of our complaints, to get in and access what's going on inside a massive warehouse. Some of these are like 1 million square feet. The last thing I'll mention is that I think it's really important when we think about climate equity in the future of work in industries like ours, is that the climate change is going to interact with the employer practices, and some of these practices are really just making things worse. So what we see happening in warehouse work is that with new technologies and the growth in online retail and the need for quick delivery speeds to customers, that increasingly warehouse employers are using very sophisticated technology, electronic monitoring, artificial intelligence, algorithmic management, to figure out how to manage workers down to the microsecond and push them to work as fast and as hard as they can for a 10-hour shift. And this is causing huge spikes in ergonomic injuries, but it also really contributes to heat illness. Because as you probably all know, a huge factor of heat illness in addition to the temperature is how hard you're working, your work activity level. So as this gets worse, I think we'll see increased vulnerability to heat illness, unfortunately. And we saw that play out with COVID as well, that people were so beholden to this tracking and surveillance and these quotas that there wasn't time often to follow social distancing rules or to clean workstations and things like that. So it's a big problem that we're tackling, and workers are organizing to fight for this. We won some policy changes, including a bill last year called AB 701 to try to limit some of these quotas, but we need to do more in California to, I think, recognize heat illness and these other environmental threats as workplace injuries, to record them better, and to give workers the tools to be able to fight for their rights, to organize in the workplace, to have more democracy in the workplace, because they're the ones who know what's going on, who experience these conditions, to be able to lead in really implementing the changes that we need to see. So I think I'm well out of time, so I'll stop there, and we'll can answer questions later at the end. So thank you again so much for having us. It's really great to participate today.
Hey. Thank you, Tim, for shining light on the conditions faced by our warehouse workers and the work that you're doing. So right now, we're going to take a short break and plan to resume the second part of our meeting at 3:07. So a short 5-minute break. Thank you.
Ain't no valley low, ain't no river wide enough, baby. If you need me, call me, no matter where you are, no matter how far. Don't worry, baby, just call my name, I'll be there in a hurry. You don't have to worry, 'cause baby, there ain't no mountain high enough, ain't no valley low enough, ain't no river wide enough to keep me from getting to you, baby. Remember the day I set you free. know that there ain't no mountain high enough, ain't no valley low enough, ain't no river wide enough, ain't no mountain high enough, ain't no valley low enough. What's the matter with your hair? Yeah. What's the matter with your mind and your sign? Oh, nothing the matter with your head, baby. Find it. Come on and find it. With it, baby, 'cause you're fine and you're mine and you look so divine. Come and get your love. 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 What's the matter with you? Feel right? Don't you feel right, baby? Oh yeah. Get it from the main line. All right. I say to find it, find it. Love and love it if you like it. Yeah. It's your business if you want some, take some. Get it together, baby. Come and get your love. Come and get your love. Great. Hope folks are able to get back to our program. So we'll be moving on to our next presenter. We have David Hornung. David started working for Cal OSHA in 2009 as compliance officer in Oakland. He spent his first summers with Cal OSHA performing heat inspections in the early days of the heat illness prevention standard. He's currently the statewide heat and agricultural program coordinator. So welcome, David.
Thank you. Well, good afternoon. I do have some slides I hope to share if we could enable that. I'd like to thank too all the previous speakers for sharing their perspective on how climate change is affecting workers and their work. When I started at Cal OSHA 13 years ago, some of my first work was doing heat sweeps, which is where you drive around to try to find outdoor workers and ensure they're protected from the heat. It was only then that I really gained my appreciation for how hard the outdoor work was, and particularly ag work. Unless you've picked grapes yourself or seen ag workers pick grapes, it's hard to understand just how hard that work is. These workers are quickly picking grapes and their hands are just covered in grape juice. Yellow jackets are swarming around. Because the work is often piece rate, they're working at a fast clip in what can be 100-degree weather. It's very tiring, difficult work. Ag work is also arguably the most dangerous occupation in the state. Over the last 5 years, agricultural workers have died at the highest rate of any industry, a rate 5 times higher than the average across other industries. Many people, me included, are viewing our heat and wildfire smoke regulations and enforcement as an equity issue. We know a higher portion of outdoor workers are workers of color, and they're disproportionately being affected by the hot summers and the worst air quality. Today, I'm going to start talking about some of Cal OSHA's climate-related regulations and how those were affected by the pandemic and some of the lessons we learned over the past 2 years. Thanks for letting me share the screen. Last month, I hosted a training course for some of our new Cal OSHA staff on our heat illness prevention regulation, and it was a full day training. Today, I have just 8 minutes or maybe 10, so I'm going to give a very high-level overview of our current regulation on wildfire smoke, heat, and COVID. Let me start with the COVID-19 prevention regulation. About 2 weeks ago, on April 21st, the Occupational Safety and Health Standards Board readopted our COVID-19 prevention emergency temporary standards for the third time. The regulations were revised. There's actually 5 regulations to make them more flexible if changes are made to the CDPH guidance in the future. The emergency standards became effective on May 6th, which is just last Friday, and will remain in effect through the end of the year. The regulation requires employers to establish, implement, and maintain an effective written COVID-19 prevention program that identifies and that includes identifying and evaluating employee exposures to COVID-19 health hazards. Employers must provide effective training to employees on how COVID-19 is spread, infection prevention techniques, and information regarding COVID-19 related benefits, such as paid sick leave. The current COVID-19 standard says that face coverings are mandatory when CDPH requires their use. Next, let me address wildfire smoke. If anyone on today's call has been attending these meetings for a long time and has a really great memory, you may recall that about 3 years ago, my colleague Amalia Neihart presented.
Mi colega Mala y yo presentamos este grupo hablando de un nuevo regulación con respecto a los peligros de incendios forestales. Un mes después de su presentación en julio de 2019, Cal OSHA tenía una nueva regulación sobre.
Emergency regulations typically last just 1 year. You can see here that this regulation was just in time, as wildfires have only gotten bigger since 2019. The pie charts, these pie charts both show the 20 largest California wildfires by acres burned. The left graphic, CAL FIRE put out in 2020, and the right graphic they put out in 2021. And in the graphic to the right, you can see the wildfires in 2020 and 2021 make up over half this graph. These fires were just so large. And I'm sure everyone on this call, if you've been living in California, you have seen and you have smelled and you have felt the smoke from these wildfires. Like COVID, Cal OSHA adopted our wildfire smoke regulation through the emergency rulemaking process. And it was just at the beginning of last year in February that these rules were adopted as a permanent regulation. Again, at that really high level overview, the regulation requires employers to take action when the air quality index, or AQI, is above 150 for particulate matter. Once it hits this level, the employer must train workers on the hazards of wildfire smoke and how they can protect themselves, including using N95 masks, which the employer must not only provide, but also encourage workers to use. In early COVID, there was a lot of confusion about face coverings, masks, and respirators, and what was acceptable when. I think there's less confusion now, but it's certainly still confusing. Our wildfire smoke regulation requires N95 respirators, which are sometimes called dust masks. Even our respiratory protection regulation actually refers to them as dust masks. Our COVID-19 prevention regulation requires face coverings, which can be N95 respirators, but can also be fabric masks with ear loops. We spent a lot of time in our education and outreach materials of trying to clarify the differences between masks and respirators and explaining which are appropriate for each hazard. As Amy said early today, California was the first state to adopt a heat illness prevention regulation. We did this over 15 years ago and have updated and strengthened the regulation twice since then. The regulation requires for outdoor workers the employer to provide water, shade, rest breaks, and training. The employer must also have a written plan, which includes when and how to call emergency services, like 911 when an employee gets sick. And notably, it requires them to provide directions to the work site, where we had heard a story before, and especially in agriculture, it can be hard to find some work sites. When the pandemic started, we had to figure out how COVID affected the heat illness prevention regulation. Our regulation itself didn't change, but our interpretation and enforcement of the regulation did. For instance, the regulation requires that the employer provide shade, and that shade must not expose employees to unsafe or unhealthy conditions. Is it unhealthy to sit under a shade structure right next to someone that may have COVID? To address this, we required employers to provide enough shade to allow social distancing while in the shade. What about everyone drinking from the same water container? We had heard some employers stop providing water to their workers because of COVID concerns. Of course, that's not allowed. Employers had to find a way to provide water safely. You may also recall that early in the pandemic, many employers shut down, which posed a problem to workers when they had to come back to work that summer and work outdoors. Their bodies were not used to working in the heat, and in 2020, we had one such worker die from a heat-related illness. It took Cal OSHA some time to figure out how to interpret our current regulations in light of the pandemic. Since 2017, Cal OSHA has been working on a draft indoor heat regulation. We are still in what we call pre-rulemaking, which means we haven't started our one-year clock on the official rulemaking process. But last month, for the first time, I heard Cal OSHA's Research and Standards Unit share a date for when he thought the regulation would be done. He thought it would start official rulemaking by the end of this year and be completed by the end of next year. So the question is, how do we protect workers from hot indoor environments like those warehouses that Tim mentioned until we have an indoor heat regulation? And we do this in a similar way to how Cal OSHA protects workers from COVID before we had a COVID-19 prevention emergency regulation. That regulation for COVID didn't come until November of 2020. We use a regulation from the early 90s called the Injury and Illness Prevention Program. This regulation requires all employers to provide a safe workplace, which includes identifying hazards and correcting them. Of course, there are drawbacks to using a more general regulation to protect workers. The Injury and Illness Prevention Program regulation doesn't have specifics on what the employer must do to protect workers from indoor heat or COVID. Employers will have different interpretations about what they must do to protect workers. Similarly, workers won't be clear on what obligations their employers have. They may ask, when does my employer need to provide me with water, or a cool down rest break, or a face covering? By having a specific regulation, as we now do for COVID, the expectations of the employers are clear. Cal OSHA has put out many fact sheets and training on what the COVID-19 prevention-related obligations are. Unfortunately, until we have an indoor heat regulation, Cal OSHA won't be able to provide clear requirements for the employers. We have to point employers to our draft indoor heat regulation and tell them best practices for preventing heat-related illness indoors. And of course, we remind employers of their duty under the Injury and Illness Prevention Program to keep their workers safe. For all the hazards I've discussed today, Cal OSHA continues its outreach and training efforts to inform employers of their obligations and workers of their rights. We've had great success with our Water, Rest, Shade campaign, which was started in 2010. We developed this campaign with the Labor and Occupational Health Program at UC Berkeley. On our website, 99 Calor, anyone can order free training materials or fact sheets. If anyone on this call knows anyone that could benefit from these materials, please go to the website and you'll find instructions on how to order. It's free to order and shipping's free as well. Thank you for the opportunity to speak today, and I hope we have some time for questions at the end.
Great. Thank you, David, for sharing an overview of Cal OSHA's regulatory work. Next up, we have Climate Resolve. So Chris Eclarino is the technical project manager at Climate Resolve. His work for Climate Resolve includes reviewing municipal climate adaptation strategies, conducting analyses using climate data sets to identify climate vulnerable municipalities, and researching the impacts of extreme heat and wildfire smoke on vulnerable worker populations. He holds a Master of Public Policy from UCLA. And Natalie Delgado holds a Bachelor's of Science in Educational Studies from Syracuse University and has held several positions in the educational and mental health fields before transitioning into the environmental field. Welcome both Chris and Natalie.
Thank you for the introduction. I want to extend my thanks to all of the previous presenters. Today, we'll be presenting on our forthcoming report, Exhausted Workers Confront Extreme Heat and Wildfire Smoke in California. We'll be giving a high-level overview of the findings of our report. And I'll turn it over to Nat.
Yeah, thank you, Chris. And so next slide, please. So essential workers have always kept the United States running, even at the expense of their health. However, we've found that despite their importance, many essential workers aren't offered the protections they need to continue working in a way that prioritizes their health. A lot of the times, they're not given access to cool environments, access to water, and access to proper ventilation or even other safety measures. And I think this is something that's been highlighted in all the previous presentations. So it kind of raises the question, next slide, please. If society has reciprocated this by ensuring the health of California's essential workers who are responsible for harvesting so many crops and who are also responsible in the growing transportation and warehouse industry. And I'll go ahead and pass it over to my coworker, Chris.
Next slide. To address major gaps in statewide policies and programs protecting worker health, our research methodology included conducting a literature review of over 60 studies and reports, interviewing 24 stakeholders mentioned on the slide here, including state agency staff, academic experts, labor environmental advocates, and workers themselves. And lastly, analyzing federal and state laws, regulations, codes, and standards. Next slide. And now to touch upon the working conditions of both outdoor and indoor workers, first starting with outdoor workers. Next slide. Outdoor workers, including ag workers.
Trabajadores al aire libre en Estados Unidos enfrentan, o sea, entre muchas ocupaciones, la de agricultura, enfrentan 30 veces más riesgo de morir por exposición al calor que la población general y están desproporcionadamente expuestos al humo de los incendios forestales. Y en el 2019 reportaron mucho que estaban trabajando en medio de un humo tenso sin ninguna de las garantías requeridas que les otorga la norma de humo de incendios forestales de emergencia de Cal OSHA. Y durante la última década, California experimentó su década más calurosa registrada.
2 deaths as well. Next slide. Some highlights from our research on heat impacts on outdoor workers, specifically hotter temperatures increasing workplace accidents by up to 5 to 7% on days between 85 and 90 degrees Fahrenheit, and by 10% to 15% on days above 100 degrees Fahrenheit. And that Latinx people were 3.2 times more likely to die of work-related heat exposure than non-Latinx populations due to overrepresentation in outdoor occupations. And as mentioned in the previous presentation, in 2006, Cal OSHA adopted its heat illness prevention standard for outdoor workers and has cited hundreds of workplaces each year for non-compliance. Next slide. Some highlights from our research on wildfire smoke air quality impacts. There's a growing concern about the effects of wildfire smoke as wildfire events have become more frequent and intense. And wildfire smoke has led to high PM 2.5 concentration exceeding regulatory standards. Next slide. And now to turn it over back to Nat.
Thank you, Chris. So I'll be covering another group that we really analyzed in regards to how extreme heat and wildfire smoke has affected them, and that's indoor workers. And indoor workers have represented a workforce that's overlooked in regards to these two extreme weather categories. And the effects of extreme heat on these workers in an air-conditioned environments have not necessarily been studied or addressed by California policymakers. And we even found during our literature review that there was not a lot of literature there that showed the impacts of working in unventilated, unair-conditioned environments. And in 2017, the Division of Occupational Safety and Health also held an advisory meeting to draft a regulation on reducing heat-related illness within places of indoor employment. However, that draft has actually not been updated since 2019. So it's been almost 2 years since anything has happened in regards to that indoor heat standard. Next slide, please. And so indoor workers face a variety of health risks and challenges with those challenges being ventilation and indoor air pollution. A lot of the times there is a lack of ventilation in their work environments that exacerbate already existing medical conditions, which can eventually lead to hospitalizations. And another challenge to really know is that ventilation is typically left to the discretion of the building or business owner. So a lot of building or business owners won't necessarily invest in adequate ventilation because it can result in paying a higher utility bill. And in regards to indoor air pollution, indoor workers also face a variety of indoor air pollutants in the environment, chemicals such as off-gas from paint, building materials, machines, and even furniture. And we also found that additionally, indoor workplaces that are poorly sealed have unmaintained HVAC units with air filters less than MERV 13 can draw on wildfire smoke borne PM 2.5. So this kind of shows that even though these workers may be working in an indoor setting, they're not necessarily protected from the effects of indoor smoke. And yeah, next slide. All right, and then another thing I did want to touch upon is heat stress. And so heat stress is defined as the buildup of body heat due to muscle use of the environment. And so in these indoor workspaces, these working environments lack systems to help workers control their heat stress or manage their heat stress. For example, in an interview that we had, their working environment forces them to kind of skip water breaks to meet their quotas. And so these high demand, high pressure environments don't necessarily provide a healthy environment for workers to prioritize their health. And so I'm going to go ahead and pass it on to Chris.
Great. And now to briefly touch upon some of the existing regulations and proposed regulations that we reviewed in our research. Next slide. We reviewed Cal OSHA's heat standard for outdoor workers and Cal OSHA's wildfire smoke standard for both outdoor and indoor workers from wildfire smoke. And we also looked at SB 606, which was passed this year, increasing the amount of penalties for violating Cal OSHA regulations. Lastly, we also looked at the proposed heat illness prevention in indoor places of employment draft standard. Next slide. And turn it back over to Nat.
Yeah, and I'm gonna just briefly touch upon the gaps that we found in the report. And these gaps really span upon local, state, and federal levels. And so we found that Cal OSHA's enforcement branch has been historically understaffed. We found, as mentioned before, there's been a delay in adopting an indoor heat standard. And we found that state, county, and local agencies are working independently rather than working with one another. And then we found that little to no accountability exists for employers who seek to evade responsibility by hiding behind farm labor contractors. Lastly, one of the major gaps we also found was that employers also often times fail to educate their workers on heat prevention strategies at the workplace. And I'll go ahead and pass it to Chris one more time.
And finally, we'll briefly touch upon the 18 recommendations that specific actors can take to safeguard worker health from heat and wildfire smoke impacts. Number one, recommending that the California Division of Workers' Compensation should work with the California Department of Insurance to create new insurance products designed to protect workers, such as parametric insurance coverage, recommending a tiered system with defined heat and air quality thresholds to determine hazard pay, exclusionary pay, and insurance coverage. Number two, designing and building large-scale cooling projects in the built environment to help workers recover from heat stress away from the job site. Number three, making home a safe haven, expanding current standards for home cooling. Four, state agencies must coordinate their approach on extreme heat. Five, funding Cal OSHA to update standards and perform educational and enforcement activities to deter non-compliance and to reduce the number of workplace injuries. And six, improving communications on drinking water with an educational communications campaign about the importance of regularly drinking water during extreme heat days. Next slide.
Yeah, and I'll go ahead and expand on our continued list that emphasize protecting outdoor and indoor workers. Number 7 was expand independent monitoring by funding third parties to bring workplace violations to the attention of Cal OSHA. Number 8 is fixing Cal OSHA's communications problem by creating a communications campaign that informs workers of their rights and specifically really partnering with an already trusted organization. Number 9, environmental organizations must prioritize worker health and safety by promoting laws that protect human health as much as they promote laws that value environmental health and wildlife health. Number 10 is develop a centralized Cal OSHA database on heat-related workplace incidents that is linked to a statewide heat syndromic surveillance system. Number 11 is to improve air quality monitoring in the workplace. And 12 is fund organizations to assist workers who are already, again, trusted by the community to communicate with others about their rights and the dangers of heat. Next slide, please. And then in our recommendations, we also did want to point out specific recommendations that are tailored towards outdoor workers and indoor workers. And the recommendations that are specific for outdoor workers are providing clean air refuges during wildfire smoke events by creating temporary shelters with air purifiers, and really holding growers accountable by having Cal OSHA really close all the loopholes that growers have used to avoid enforcement of labor violations and change their name. And then I'll go ahead and pass it to Chris to wrap this presentation up.
Great, thanks, Nat. Number 15, prioritizing the adoption of the indoor heat illness prevention standard. And we recommend once adopted, Cal OSHA performing robust outreach and education about the new regulation. 16, updating the building energy efficiency standards, Title 24 to address both energy efficiency as well as indoor air temperature. 17, updating the ASHRAE IES energy efficiency standard and the International Energy Conservation Code to include real-time indoor temperature and humidity monitoring. And finally, recommending the state of California to fund research to quantify economic losses due to heat and smoke exposure within various sectors in California. And with that, that concludes our presentation. I thank you all again. I'll be putting our emails in the chat and a link to sign up to our newsletter to be informed when our reports get published on our website. But thank you for extending this opportunity again.
Great. Thank you so much, Chris and Natalie, for this overview and a preview of the Climate Resolve upcoming report. So we look forward to the release of the full version. So next up, we have Edward Flores. He is an associate professor of sociology at UC Merced. His research focuses on race, gender, immigration, labor, religion, and local social movements. More recently, his research has focused on low-wage work in the San Joaquin Valley, and he serves as the faculty director of the UC Merced Community and Labor Center. Thank you again, and take it away, Professor Flores.
Thank you. Okay, so you've got my PowerPoint on the screen. Sorry about that. All right, so I'm just going to share a little bit about the UC Merced Farm Worker Health Study. I'm along with Anna Padilla and Paul Brown. We are close to writing a final report based on a 2-year study that was the largest of its kind ever conducted on the health and well-being of the nation's most disadvantaged workforce. How do I move it to the next slide?
¿Cómo podría pasar a la siguiente diapositiva? Ok, disculpe. Así que el estudio de salud de trabajadores agrícolas es un estudio de 2 años por el estado de California que fue regulado por el Departamento de Salud. Es el único estado de el único estudio de este tipo.
Our center, the community and labor
Nuestro centro de trabajo y comunidad, entonces lidió el estudio y
in developing the study was forming a community advisory board with leaders from dozens of farm worker serving organizations across the state. Next slide, please. So a little bit about our center. We were established in May of 2020. We're the largest labor center serving a rural area in the United States. Starting in March, we had begun a monthly series of policy briefs and fact sheets, many of them focused on workplace health and safety, unemployment, the need for a safety net among undocumented immigrant workers. Our research has informed the development of and passage of several major state policies, such as AB 1876, which expanded the California Earned Income Tax Credit to undocumented working families. And we have several ongoing collaborations with community and labor groups that complemented the Farm Worker Health Study. So I'll share right now just a brief profile of California farm workers. This data that I'm sharing is from the American Community Survey, which is the largest survey of its kind in the country. Every year, the American Community Survey samples 1% of American households and collects data on a number of indicators such as demographics, workforce participation, immigration. And so when we look at the American Community Survey for California, when we pull together a 5-year sample that captures 5% of all households, what we see is that there's roughly 370,000 workers in the agricultural industry, 78% of them in crop production. Now, these numbers are, if anything, an underestimate, because the American Community Survey presents data as an average for the year. And we know that the bulk of farm working is done between March and November. So these are just annual averages for the number of people that are employed in the industry at any given moment in time. It's actually going to be much higher between the months of March and November. We also know that most workers in the agricultural industry are what the census would call other agricultural workers or graders and sorters. so, you know, few of these workers have defined skills, you know, that would classify them as skilled workers. You know, they're out for the most part just harvesting and packaging what's collected in the fields. Half of all farm workers live in the Central Valley, 49.6%. 13.4% are located in the Central Coast, 5.7% in the Sacramento Valley. And most regions in the state have less than 5% of their workforce have less than 5% of the agricultural industry's workforce. And this is the final slide I'll share on a profile of California farm workers. We know that their average age is 40. Only roughly about 1 out of 3 are women, but that 80% are immigrant and 70% are non-citizen, many of them undocumented. We also know that they have higher rates of unemployment because of the lack of farm work between the months of November and March, and that their rate of health insurance is one of the lowest among all occupational groups. Only 64% report having any form of health insurance. Their average salaries and wages are below $20,000 a year. Okay, next slide, please. So the purpose of the Farm Worker Health Study was to determine the health of farm workers in California. This included both health, but also the social determinants of health. The work that we conducted was with over 30 farm workers. We had 30 farm worker serving organizations on our community advisory board, some of them that presented earlier today, such as MICOP or Líderes Campesinas. We sampled over 1,100 farm workers. So the groups we worked with collected this data. They conducted 2 to 4 hour surveys in person with COVID protocols in place in 6 different languages, and oversampled women and indigenous workers because there's a lack of data on workers of that demographic profile. And the data was drawn from several of California's agricultural regions. This is probably the most important thing I would want to communicate at this stage about our study, and what makes it so unique was that we had an amazing community advisory board that included 12 organizations that helped us collect data, but throughout the process, close to 30 organizations helped us develop the survey, draft recommendations for questions that should be included, questions that had never been asked before about farm workers and their experiences with workplace health and safety, such as employer compliance with the California heat standard, or at how many weeks an expectant mother was allowed to stop working, or how old a child was when they had to go back to work. So we conducted, we designed the study in close communication with our community advisory board, and even throughout the process, we had lots of interviewer trainings, regular weekly check-ins. I see I'm at about time, so I'm just gonna wrap it up now. We can move to the last slide, I think. Yeah, so we've just finished cleaning the data and categorizing the variables. And so the work before us right now is writing a draft report and providing some recommendations. So we're planning on hosting a town hall that's going to invite members of the agricultural communities, public agencies, community-based organizations, and the media sometime in July. And this is a process that we're currently developing with members of our community advisory board. Thank you.
Great. Thank you, Professor, and to the entire UC Merced team as well for your ongoing efforts on the study and using a community-centered approach. So for our final presenter, we have Sloan Viola, who is the Integrated Climate Adaptation and Resiliency Programs Council Program Manager. So she previously served as the Legislative Director at the Governor's Office of Planning Research, representing the office's interest in the legislative process. She earned her bachelor's and master's degrees in aquatic biology and ecology, evolution, and marine biology from the University of California, Santa Barbara. Welcome, Sloan.
Thank you, Dan, and thanks to everyone who's been here for the extent of the meeting. I'm going to really quickly provide an overview of the 2021 update to the California Climate Adaptation Strategy and the release of the 2022 Extreme Heat Action Plan. So this update to the California Climate Adaptation Strategy was a tremendous undertaking done in close partnership with the Governor's Office of Planning and Research and the California Natural Resources Agency. And our entities took an innovative approach with this update. One way this was an innovative approach is that instead of releasing a several hundred-page report, we've created an interactive website to convey this information on all of the actions that the state is taking to address climate risk. Another area where this update has taken a new and innovative approach is that we've oriented all of our actions around outcome-based priorities. So for the conversation today, very relevant that one of our priorities is bolstering public health and safety to protect against increasing climate risks. Within each priority, there are several goals and outcome-based actions, as well as metrics to assess progress in achieving those goals. So relevant to this conversation today, I wanted to highlight Goal A, which relates to reducing urgent risks to public health and safety. And Action 1 in particular, reducing health impacts of wildfire smoke, has several success metrics that all relate to the conversations that have been happening today. And one other goal action I wanted to call attention to is here in our second goal. Action 12 relates to a pilot program for community health promoters in the San Joaquin Valley to refer residents, and particularly farm workers, with climate-related health conditions to receive prioritized access to services that can improve their health and housing. During this update to the climate adaptation strategy, it quickly became apparent that addressing extreme heat was an area where a special focus was needed. The state last created a framework for addressing extreme heat in 2013, and it had yet to be updated. So as part of this update to the climate adaptation strategy, concurrently, we took a deep dive into extreme heat, which resulted in this Extreme Heat Action Plan, which was released recently. And again, for the conversation today, I hope this audience is very excited to see that Action Track B, with strengthening community services and response, includes specific actions and goals related to protecting California's workers and economy from the impacts of extreme heat. Some of these actions are established and have already been identified in that prior 2013 report, and the state is still working to drive towards those goals. And then this report also identified new actions, which in the report I identified as recommended actions. So we have several new actions to supplement the work that we are already doing and striving to achieve to move even further in addressing extreme heat. I'll share the links to these resources in the chat so that all of the participants can access them and peruse them at their leisure. And just wanted to say thank you for the time today.
Great. Thank you, Sloan, for that quick overview of the updated state climate adaptation strategy and the Extreme Heat Action Plan, two major components in our work to adapt to and address a changing climate. So finally, we're going to move into the discussion portion. And so I'll turn it back to Linda Helen to take it from here.
Thanks, Dan, and thanks to all of our speakers. Really appreciate your wisdom and your experiences and everything that you've shared for us. We have just 11 minutes, about 10 minutes of questions and answers. And there's been some great discussion in the chat. I'm just going to start by following up on a couple of those. And then we also have some questions that have already been provided during registration. But go ahead and keep putting questions in the chat. We may or may not get to them. So first one that has a lot of resonance was, what kinds of policy changes are needed so that farm workers and particularly undocumented workers can report unsafe working conditions without fear of retribution. And related to that, there was a discussion in the chat about anonymous complaints, perhaps not being investigated with an in-person visit, but rather a letter to the employer. Maybe David could respond to that. Is there a way to provide robust responses to complaints while protecting anonymity, or how does that work? Thanks.
Yeah, I think it's a difficult problem for sure, and I don't have a silver bullet solution. I will say that any worker can file a complaint confidentially. They can provide their contact information, and that's never released to the employer. It is protected, and that allows us to follow up with the complainant in case there are times when we perhaps respond to a complaint and go out to the farm site maybe a day or two after the complaint comes in and the work has moved on. And it can be difficult to find those job sites. We do have a complaint phone number. It's staffed 24 hours a day by a human. There's no numbers to press. You call and you get a human, which I think is pretty rare. During the daytime, 8 to 5, you actually reach a compliance officer or an inspector in the office. And then outside of those working hours, you're going to get an answering service that will transmit your information. So we try to make it easy to file complaints. We do rely on the help of our other organizations to help encourage employees to file complaints with us. Many, like United Farm Workers or CRLA, help take complaints and provide them to Cal OSHA, or perhaps those organizations file on behalf of the complainant. That's another way to get that. But we do recognize that it is a difficult problem, that these employees may not have a permanent address or a permanent phone number, and it can make it difficult to, and certainly the fear of reprisal is real. And we try to address that with our confidentiality.
Okay, thank you so much. And there was also some discussion in the chat about having the hotline, having Spanish and Indigenous languages as well. Are those available?
We do have translation services available. I think last year we did about 20,000 minutes of Spanish to English interpretation, and our service also provided interpretation in 19 other languages. It has been a hard time to find Indigenous language speakers and to get them on contract and to coordinate for the inspections. It's an issue that we've been trying to address.
Thank you so much. And we are getting short of time. So at this point, I'm just going to ask the speakers to each take 30 seconds and tell us what are your final thoughts, your final 30 seconds of recommendations after hearing all the other speakers and their experiences from a solution space, what can and should be done. I think Secretary Palugiai is no longer with us on the call, I believe. Go ahead and break in if you are. But if not, then we'll go to Amy Heinzerling of CDPH first, and then followed by Yasmin, Josefino, Eulalia, Claudia, and Isadora.
Hi, yes. I think my biggest takeaway from hearing all these great presentations today was just how much overlap I think there is between the work that all of our organizations do. And I think there are a lot of opportunities for us to work together to take advantage of the work that we're already doing and build on that to do more work. There certainly is still a great need to address the many climate-related impacts that workers in California face. So look forward to working with many of you on that going forward.
Thanks, Amy. Okay, Yasmin, then Josefina, Eulalia, and Claudia, and then Isadora. What are your final recommendations for this group? What are next steps that are most urgent?
Eulalia o Josefino, ¿quieren compartir unas palabras finales?
Yo lo puedo hacer. Buenas tardes, muchas gracias. Mi recomendación final es trabajar en conjunto y hacer que la información llegue a los campos agrícolas, que sea lingüístico, accesible y cultural para los trabajadores y jornaleros que vienen de distinta parte de México que solamente hablan un idioma indígena, ya que en todos los lugares no les llega la información. Lamentablemente no saben leer ni escribir y aparte de eso, toda la información está en inglés. Entonces, ver la manera de que ellos reciban esta información en su propia lengua. Por eso estamos trabajando duro para un sistema de audio para cuando haya otra quemazón como el Thomas, no les pase lo que a mí me pasó, que yo después de 2 semanas aún escupía cenizas por la nariz. Muchas gracias.
Sí, muchísimas gracias. Pues eso, si queremos que nos llegue a nuestro idioma y un video o algo para saber y para saber y para estar información, para tener información y trabajar juntos, podemos salir adelante con todos nuestros compañeros del trabajo y tenemos que echarle gana y salir adelante con nuestra familia. Muchísimas gracias, le agradezco de todo corazón.
Thank you, everyone. Yeah, I agree that there's a lot of overlap between what we're all doing. And if anyone wants to talk to us about our work, I invite you to reach out to us at info@trackingcalifornia.org. And we can discuss with what we're working on with these audio alerts about workplace rights information, and what we're working towards in terms of simplified workplace complaint reporting. Thank you so much. That work is being led by Mike Oppenlideres, and we're serving in a technical support role.
Great, thank you all so much. Chris and Natalie, Climate Resolve, final recommendations. And if all the speakers want to come on camera and unmute, be ready.
Yeah, so my big takeaway and what I feel like our report highlights is the need for the state of California to fund organizations like MyCop that are trusted within the community to better facilitate, information on how to file a complaint, and also spreading vital information to those who speak Indigenous languages as well. I think, with the stories that were highlighted, it really hammers that disconnect, unfortunately, that we see from time to time. And I could turn it over to Nat as well.
Yeah, just kind of elaborating on what Chris said. And I think something that Isadora just highlighted was just us working collaboratively, just because so many of us are doing this work. And it's hard, with all the workplace demands, but I think really finding time to create a collective or collaboration at the state, local, and federal level, I think would really help. That's my final recommendation.
Thank you. Let's see, let's go to Tim Shaddix.
I think, as others have said, we've seen a lot of possibility for collaboration here. So I think continuing that, convening more of these opportunities. There's a lot more that needs to be done on enforcement, I think, and we can all support that. But since this is a public health group, I'll say also, I think we heard that there's a huge problem with heat illness and a lot of underreporting. So to the extent that the public health community can help us better document this, so that we can make the case for more funding for enforcement, more funding for the work that our organizations are doing, I think that would be very valuable.
Yes, great, thank you. And David Hornung, final thoughts, next steps.
Well, I'm really excited with the prospect of there being an indoor heat regulation. We, of course, have all of these new regulations. It's important to have a strong enforcement to ensure that employers are taking the right steps to protect the employees. And we need your help to be able to notify us of any problems you see out there. And I've included my email in the chat. So please reach out if you have any ideas of how we can partner better. Thanks.
Thank you. And Edward Flores.
Yeah, I'm just thrilled to see that the conversations around the health and safety of workers and workforce development seem to be merging in the public arena, through this this webinar that we had today. We don't think of workforce development. We think of workforce development as workers having to learn how to take direction, from their bosses and execute a job. But, as we're seeing today, that also needs to involve workers learning what rights they have as they're in the workplace.
Thank you so much. And last but not least, Sloan Viola.
Thanks, Linda. I'll just conclude with saying that the state's adaptation strategy is taking an all of government, all of the above approach to prepare the state for climate change. But that doesn't stop with the state. The partnerships that are built with local, regional, tribal governments, community-based organizations, nonprofits, the academic sector, we're all in this together, and all of us rowing in the same direction will allow us to address these challenges.
Beautiful. Thank you to all of our speakers. Let's keep working together to improve health and equity for workers in California. I will now turn it over to Dan to close us out. Thank you so much.
Thank you, Linda. Just a final reminder, recordings will be available in the chat link that we shared. Thank you again to all of our speakers and to all of you for joining today. Have a wonderful rest of your day.